Welcome to the Prolotherapy pre-procedure counseling and what to expect video presentation. When we're thinking about prolotherapy, we really need to consider the source of pain. And connective tissue is ultimately what we believe is the source of a lot of pain. So what is connective tissue? It's what holds us together. It is our structure and our function. Ligaments, tendons, capsules, fascia, all of these things are part of that connective tissue structure in the body. Ligaments connect bones to bones. Tendons connect muscle to bones. But ligaments and tendons look the exact same under a microscope. The enthesis is the weak spot of the ligament or the tendon, and it's where the tendon attaches to the bone. And I like to think about a tree and where a tree goes into the ground and how these roots go into the ground. And I think about the ligaments and tendons doing basically the same thing at the surface of the bone and then going into the bone. And the enthesis ultimately is the weakest spot of the ligament or tendon. Connective tissue and specifically these ligaments and tendons are very densely innervated with nerve fibers. The density of those nerve fibers is equal to that of our sensory receptors in our skin. That sends a signal to the brain, and the brain can interpret those signals in a variety of different ways, and it can be interpreted as weakness, numbness, tingling, burning, instability. There's all kinds of ways that can be interpreted by the brain. So what is prolotherapy? Prolotherapy is an injection technique where we are injecting a proliferant or an irritant solution into these damaged ligaments and tendons or this damaged connective tissue in order to promote healing, decrease pain, and improve function. Again, we think that a lot of musculoskeletal pain is actually caused by ligament and tendon relaxation, and if we inject a proliferant into these tissues, it stimulates an inflammatory response which ultimately causes fibroblasts to migrate into the area and begin healing these tissues. And when we heal these tissues, then pain and function will improve. So what is the procedure like? Well, first we get an informed consent, and ultimately that's the purpose of this video. We want to do a good history and physical exam. What happened? Where is the source of pain? And we do that by pushing and poking on the areas that are tender. And if we can replicate the pain and the tenderness, then that suggests that those are the tissues where we need to focus our therapy. We will inject those tender points, and then we reevaluate how you are feeling after the procedure. And if we missed anything, then we may need to add more injections so that ultimately we can treat all of the areas and hopefully resolve your pain. The solution we're injecting is a standard dextrose prolotherapy solution. I inject a 15% or hypertonic dextrose solution with 0.1% lidocaine and sterile water. Intra-articular injections are basically the same, but they use a little higher concentration of dextrose and a little higher concentration of lidocaine. So what is the process? Well, obviously we're doing the initial evaluation today, and we will consider doing the first procedure today if it's clinically indicated and you are amenable to moving forward. We'll then reevaluate typically at 4-week intervals, and we would consider repeating the injection at that time. The average patient needs between 3 and 6 different procedures, again spaced 4 weeks apart. The 3 to 6 is merely trying to set the mental expectation. If we do one procedure and you're happy with your results, then we're done. The typical average patient needs between 3 and 6 rounds in order to achieve the goal of improving that pain and functionality. So here we're looking at some rabbit tendons that were injected with prolotherapy, and this was a study that was done. These tendons on the left, this one and this one, are the controls. The tendons on the right show after being treated with prolotherapy. You can see that these tendons are thicker, 40% thicker to be precise, and they extrapolate that they would be 50% stronger, so that we know prolotherapy enhances the strength and the diameter of those tendons. Typical treatment for musculoskeletal injuries often involves pain medications like Tylenol, anti-inflammatories, steroids, whether oral or injectable. And then Dr. Gabe Merkin, I believe in the 1970s, coined this term RICE, rest, ice, compress, elevate. So that's kind of a typical, usual approach for musculoskeletal injuries. However, anti-inflammatories may slow the healing process. I recommend avoiding anti-inflammatory medications for musculoskeletal pain. Again, we're trying to trigger an inflammatory response, and these medications are anti-inflammatory. So again, Dr. Merkin coined this term RICE, and he later, in 2015, came back and said it appears that both ice and complete rest may delay healing instead of helping. And there are 22 scientific articles that showed that there's really no evidence that ice made any difference at all. So I don't generally recommend ice, although I don't think it's necessarily harmful. And when you think about what can we do with prolotherapy, it is good for a multitude of different conditions. I've seen good results with headaches, temporomandibular joint or jaw pain, whiplash, low back, knee. Pretty much any of your joints can be treated with prolotherapy. And we've seen good results with plantar fasciitis as well. So there's a lot of different things we can treat with prolotherapy. Dr. C. Everett Koop was the Surgeon General of the United States under President Reagan in the 1980s, and he said this statement: "The nice thing about prolotherapy, if properly done, is that it cannot do any harm." Other options when we're trying to treat musculoskeletal pain include all of these things: anti-inflammatories, steroids, as we already mentioned, chiropractic treatment, osteopathic manipulation therapy, or what we call OMT, acupuncture, platelet-rich plasma. It's another injection technique similar to prolotherapy, but where we use your own blood to do that. We can do that procedure here in the clinic as well, and we also offer stem cell therapy when it is indicated. Of course, we could send you to physical therapy, and you could also consider surgery as well. Anytime we are doing a procedure, we have to consider potential complications. There are 3 primary complications that we may endure or come across during prolotherapy. The first one is bleeding and infection. Anytime we put a needle through skin, that is a possibility. I've been doing this for 16 years and have never seen a significant issue with bleeding or infection. Number 2, hitting a structure we don't intend to hit with a needle, something along the lines of a nerve, an artery, a vein, in some cases the lung. Those are potential areas that we could hit with a needle. Again, those are very rare, and we take painstaking details to try to make sure that that never happens, but those are still potentials, and we will discuss those further if those are high risk for your condition. The most common complication that we will see is soreness or pain after the procedure. And again, it's an inflammatory procedure, and that inflammation can go along with pain or discomfort. So what are your instructions after getting prolotherapy? Well, you want to avoid anti-inflammatory medications, as we previously discussed. So avoid Motrin, naproxen, ibuprofen, anything like that. Movement, rehabilitation, stretching, any of these are all good things to do. Apply heat as needed, and you can use as much of that as you would like to do. Is there much pain after the procedure? Generally, the pain is pretty mild, but it's usually more like an achy kind of pain, more like a bruising or something akin to that. 3 to 5 days is fairly common, but it could go for a couple of weeks. And in rare cases, it could be more severe than that. Do the injections hurt? I have had patients that said that they had haircuts that hurt worse than this. I've had other patients that needed to be sedated for the procedure. So the intensity of the discomfort varies from individual to individual. And again, we can do sedation if needed to try and make you more comfortable for the procedure. When can you continue exercising? You can start exercising right away. I rarely recommend changing or altering your activities. Generally, I would say scale back on those activities. If you're lifting weights, cut your weight by 50% and see how you do. Cut the volume down, see how you do. I would rather at the end of the week you be able to say, I could have done more, than for at the end of the week for you to say, I shouldn't have done so much. And then we'll gradually increase your exercise and activity as we go. If you have any questions, don't hesitate to let me know.